We get taught in a variety of different settings at the university. We get taught in lecture theatres where there's a large group of us. We have smaller group tutorials, and we also have a lot of our materials online. I'm just off to a lecture just now. There's a lot of support available here at RGU, from the personal tutor who will be your first port of call, to the academic support for numeracy and writing skills. There's also a counselling service and a pastoral support, who is somebody I'm going to go and see just now to talk about my travel expenses. Hi there, Anne.
Hi Andy, come in, have a seat. Can I help you with today?
Well, I had some questions.
I'm the Pastoral Support Advisor within the School of Nursing and Midwifery, and during the 3 or 4 years that you're with us, it's my job, along with your personal tutor, to help you manage the demands that are made on you throughout the programme. If you do encounter problems or difficulties, we hope that following discussion with myself, or indeed your personal tutor, that you can actually identify a plan of action which will help you manage your situation. We hope that you actually use all the services within the school and the university, and sometimes speaking it through with somebody in an objective manner will actually help you identify which are the most appropriate services to use.
Alright then, Anne, how are you doing today?
Not so bad.
Oh, we'll get a shake of hand and everything. Fantastic.
How are you?
Not bad at all. How are you? Today I'm at work. I'm on my break right now. I work in a local hospital as a bank auxiliary nurse. Whilst I do get a bursary which has allowed me to return to study after full-time employment, I supplement that income by doing shifts here. The bank offers me the flexibility to work when I want around my university commitments. Oh well, better go back to work then. And I mean, do you have any sort of concerns or worries about actually going home, given that you've been here for a little while?
No, to be quite honest, and I've got my exercise sheets. Well, you know I do them in the bed.
Absolutely, no, you're very good at it, yeah, absolutely. Okay, so, right, well, I'll leave you to it just now, okay, but we'll catch up again before you go, and best wishes. Alright, you take care.
Thank you very
Cheers,
much, Andy.
Thanks, Anne. There's plenty of things to do in Aberdeen with the kids, as an opportunity to get some sort of downtime for university. Sometimes we like to just come down to the beach and have a kick around, but as you can see the weather's not the best today. The sports facility at RGU is absolutely fantastic. It's a state-of-the-art facility. I come here most days. It's open from 6 o'clock in the morning till 10 at night, and there are a variety of memberships available to students, from either a sort of pay-as-you-go kind of facility to a longer-term membership. It's got a 25-metre swimming pool, it's got weights rooms, it's got an 11-metre climbing wall. There's over 25 different sports clubs that come here, and once you're done with all your exercising, you can even go to the cafe for a cup of coffee and a yum-yum. Whilst at RGU, you'll be going on a number of different placements to give you an experience of what it is to be a nurse. These could be anywhere in Grampian or even the Orkney and Shetland Islands. You will be required to do a number of different shifts, including evening, weekends and some nighttime shifts as well. Today I'm at Accident and Emergency at Aberdeen Royal Infirmary. Accident and Emergency can be a very exciting and dynamic place because you never know what to expect. This is Tom. He had a fall at home and he's come in with a suspected broken leg. He'll possibly have to go to theatre to have it reset. Tom's now had an x-ray, has spent a comfortable night in the ward, and he's now come down to theatre to have his leg operated on.
Hi, Mr. Fraser.
Hello.
Hi, pleased to meet you. I'm Jan. I'm the nurse that's going to be in the anaesthetic room looking after you today. Just need to ask a few questions if that's all right. Could you just tell me your name and date of birth, please?
Tom Fraser.
Okay, and your date of birth?
13/2/37.
We'll just do some checks within the department just to make sure that this is the correct patient that's coming down for the correct operation, correct site, that we know if you've got any allergies, we've got any jewellery or anything like that. What we're going to do now is we're going to take you through to the anaesthetic room. We'll get you settled down, lie you down a wee bit, get a blood pressure cuff on, get some stickies on your chest just to make sure that you take a tracing of your heart, and then the anaesthetist will come in and see you. Are you happy enough with that? Yeah. Excellent.
After Tom's been to theatre, he'll come to a ward like this for rehabilitation, where he'll receive support from a wide variety of healthcare professionals to enable him to ultimately go home safely. Whilst at university, in addition to your hospital placements, you also do some work in the community. When Tom gets discharged from hospital, he'll be looked after by the community healthcare team. These comprise of the GP, the physio, the district nurse, the occupational therapist, and some other disciplines. I'm actually just going in to see the district nurse just now.
Hi Andy, come in. Hi, I'm Suzanne. I'm the district nursing sister here.
Oh, good to meet you, Suzanne. Thanks for seeing me today. I've done a couple of placements in the community. I was really quite interested to see how you got into community nursing.
Okay, well it took a while for me to decide to come into community. I worked in oncology for a couple of years, and then after that I actually moved on to work in the vascular and general surgical high dependency unit.
Oh, right.
I then went to work in the intensive care unit for a year.
Yeah, okay.
After that, decided that I really fancied trying out community nursing. So I began working in the community in 2004.
Right.
I worked for a year as a community nurse, and then decided that the community was for me, and that I'd like to take my career further.
Right.
So I started the degree in public health, specialising in district nursing.
Right.
So that's where we are today.
Okay, Suzanne, well, thanks very much for your time. That's certainly given me some food for thought for the future, and thank you very much.
Good.
Okay.
Great. Nice to meet you.
Bye now.